Good morning, ladies and gentlemen, and most welcome to our dear panelists and everyone who is watching us from either your home or office. Our moderator is currently having a couple of issues with her device, but she will be joining us shortly, and she will be give me a sec. And she will be joining us very shortly as soon as she gets all of that rectified. But in the meanwhile, please stay online. We shall be starting this amazing webinar hosted by Tabitha Namwone and with our amazing panelists that she will be introducing as soon as she gets this rectified.
Good morning, ladies and gentlemen. Okay. Good morning, Irene. Could you unmute?
Good morning, Brenda.
Yes. Good morning, Daniel. Hello, Daniel, are you with us?
Hello.
Yes, Daniel, good morning.
Good morning. You're very low.
Okay.
Good
Can you
morning.
hear me? Yes, please.
I can hear you, but you're very low.
Is it the same for everyone, Irene?
I can hear you perfectly.
It is much better now.
Much better now.
Yes, please.
Okay. Meddy, good morning.
Good morning. I don't know. Is my audio much better? In the
Yes,
early
yes.
it was bad.
You're perfect. You're perfect. You're perfect.
I am at work, so if you see people moving around, it's no cause for alarm.
Okay. Is everybody
Cool.
doing great today?
Oh yeah, we're doing good.
I think we're waiting for one more person. That's Honorable Rose Namayanja. Join us as soon as possible. So, in light of COVID-19 and its effect on women and girls and its social impact on them. So, to introduce the topic, menstrual hygiene management or menstrual hygiene and management is about access to menstrual hygiene products, privacy to change materials, and access to facilities to dispose of used management materials. What I'm going to do is screen share in a short while, and then I will speak as I show you a few things that I prepared to introduce ourselves. So,
okay.
We have started the webinar, or we are being debriefed. I need to get.
oh, we are starting.
Okay, perfect.
So this is for all the people who are watching live on the various social media platforms. Thank you for joining us today. And we're happy to have you, and we hope to see you join us more often in more webinars that we're going to hold in the near future. So today's topic is the impact of COVID-19 on women and girls' menstrual health management and social well-being. Our panel is made up of a couple of very prolific individuals who are great in their own right. My name is Namwone Brenda Tabitha. I am your moderator for today. I am a member of Students Against COVID. That is the organization that is helping us, that is enabling us to have this webinar today, along with the Namayanja Foundation, our partner. I'm a student at Makerere University Business School. I am a sexual reproductive health rights advocate and a peer educator with Reproductive Health Uganda. In addition to that, I am a feminist, software developer, and innovator. And I look forward to receiving your questions today and your questions to the panelists today. We're going to be joined by Honorable Namayanja, who is a former member of parliament. She is a lawyer, amongst other things. She is an author and security sector manager. She is also the founder of the Namayanja Foundation, that is our partner today. And she will be joining us in a few minutes. Our second panelist, who you're going to hear from, is Meddy Rutayisire, who is a final year medical student at Makerere University. He is a secretary for the clinical care subpillar for the COVID-19 task force. That shows us that he is a great individual. He's ready to give us what he knows. He's a former national officer for sexual reproductive health, and he's a former peer educator for Reproductive Health Uganda under the She Decides project. So that's our second panelist for today. Our third panelist is just a second. Second. Yes, our third panelist is Daniel Amanyire. Who is an officer with the Gender Unit at Ministry of Education and Sports. And the Gender Unit is a unit that spearheads gender mainstreaming in the sector. And it's the unit that developed the Menstrual Health Management Charter and the Menstrual Health Management Training Manual. They are currently undertaking a process to develop the Menstrual Health Management Strategic Plan. Our fourth and final panelist is Irene Mbabazi. She is the founder and a policy analyst at Center for Tomorrow that deals in promoting menstrual health management, reading culture, and skills development amongst women and girls all over the country. She is also a feminist and social entrepreneur and a policy analyst. She is passionate about working with children and has 10 years experience working in USAID. So as we wait for Honorable Namayanja to join us, I'd like us to engage in a few things. What could Meddy Rutayisire perhaps enlighten us on what menstrual hygiene management is all about? Meddy, are you still with us?
There was a small glitch in technology there. Yes. So this is my understanding of menstrual health management. So we're looking at from access to the resources for menstrual for women using menstruation, looking at pads, to having private facilities where girls and women can use these and change from to disposal. So looking at that entire spectrum affecting menstruation.
Okay. Daniel, what's your insight?
Thank you, moderator, and thank you, colleagues online. I think basically I will want to categorize menstrual health and menstrual hygiene management in 3 categories. I think the first branch typically looks at information, which is very key. What information do the beneficiary, in this case, the girls and the young women, need to have? And information, it's also broader, where you talk about the myth, the misconceptions, and the healthy information that they ought to know to go through menstruation in a healthy manner. Then the other branch would be the products. What products are there for these young girls to use? There are a number of products. There are those that are locally made. There are those that are made at home, those made in factories, those that are reusable, others are disposable, a number of them. So which products are there? And which products can be afforded by which categories of girls and young women? Then the last category or branch that I would want to place menstrual hygiene management into is facilities. Meddy hinted on facilities where you're talking about issues of water, hygiene, sanitation, which take consideration of privacy, talking about issues of the changing rooms for the girls, among others. Thank you.
Okay. And Irene, in your line of work and in what you've seen, according to what you've seen around, what is your insight on menstrual hygiene management?
Just the way Daniel has broken them down, that is also what I have encountered. But to talk more in detail about it is when I go, because I mostly work in primary schools to promote menstrual hygiene management. And we are promoting reusable sanitary pads because we found them affordable and also sustainable. And you also feel like you don't have to share a pad because we are afraid of giving out disposable sanitary pads because they can easily be shared with maybe the sister or the mother at home, and then the child won't be able to access them and access education. But as we've been doing this campaign of menstrual hygiene management, we have also come to realize other things that maybe other organizations are not noticing, from talking to girls to things like panties. So you're giving a child a pad for menstruation, but they're asking you also don't have a panty to use with it. So mine is more of in detail of menstrual hygiene. As you interact with the girls, we keep on collecting information about what problems they are facing. Because also the other thing that maybe is not mentioned among the 3 that are categorized, you look at medical assistance. Some girls are dropping out of school because they have cramps, and in the schools that I'm working with are private schools and usually have a total maybe of about 200 children, and the schools cannot afford a full-time nurse at the school. So you're looking about other small details that are actually affecting children.
So Daniel, you did mention something about safe spaces or privacy to change the materials. But
yes, please.
yes, so we realize that in certain hard to reach areas and even in the urban areas, and let's take for example slums, that is not the case for many of these girls. So what do you think these women and girls in places like slums normally do?
I didn't get the question right.
You mentioned something about privacy or areas, safe spaces where the women can change the materials that they are using in their times, eh? So
Yes, please.
you realize that in hard to reach areas and even in urban areas, for example, in slums, that is not the case for many girls and women. What do you think can be done for these people?
Okay, thank you. And this will directly take us to reflect on the theme. We're talking about menstrual hygiene management, comparing it with social impact, especially in a situation of COVID-19. So, and what we will have to appreciate at the moment is that in such a crisis, resources are going to be limited. So
Yes.
our duty as stakeholders, as advocates, is with the little resources, how best can we prioritize? So here it is a question of prioritizing. So if we have limited resources and we've identified the urban poor, or call them the young girls and the young women in slums being worst affected, I think we'll advocate that governments, that development partners, civil society organizations, and all people of goodwill divert these resources and target these more vulnerable communities. So I think the question here is about prioritizing. So if we put focus on prioritizing, that is when we'll identify slums as a worst hit area. But if we take it to the general picture, then we'll end up missing out on this core community. And yet we know that they are suffering a double burden.
Okay. So before I get back to you on that, we are joined by Honorable Rose Namayanja. Honorable, you're most welcome today. Do you have a few words to say to us? Just a second. Let me unmute. Honorable.
Hello.
Yes, hello.
Yes, I'm sorry I joined in late because I was somehow I had thought it was 11 instead of 10, but
Yeah.
nonetheless we have started, and I want to thank everyone for the efforts to have this discussion ongoing. I'll just pick it up from the person who was still, I didn't get the name because I just joined in, but basically we are looking at both the urban poor, and the challenges differ depending on the dynamics, the environment we are talking about. When you talk about, when you talk about the urban poor, you talk about the slum girls. I saw in the briefing point, talking points, you talk about the women who have been sleeping in markets. That's a huge issue that women must have been grappling with. And then you talk about these girls who didn't even know that, what menstruation is all about, and is faced with something for the first time in a community that has demonized or stigmatized menstruation. And so it's really a bigger picture that we are all looking at and reflecting on.
Okay. Thank you, Honorable. So for all people who are just joining us, we are talking about menstrual health management and social well-being. So yes, so in light of these two things, our breakdown of topics is going to be on girls in rural areas and slums, market women, people with disabilities, if we are able to get to that point. Are the men supportive to these women and girls, and affordable products, even post-COVID and during COVID? And a social well-being, we're going to talk about no school, what's the way out for many of these girls at home. Post-COVID, we're going to have dropout rates and child pregnancies. And even right now, we're having a spike in gender-based violence cases and inaccessibility to family planning methods. So let's start our topic for today. We were already discussing girls in rural areas and slums, and potentially the sanitary methods that they use. And we had spoken about safe spaces, that because safe spaces are part of things that are spoken about under menstrual health management. Privacy to change materials and access to facilities to dispose of these used materials, and safe spaces to change when the need arises. And it is important for these places to be safe, clean, and easily accessible, and a place where women are free from sexual and gender-based violence in their time of need. So, Honorable Rose Namayanja, we realize that we have a lot of girls in rural areas and slums, and you find that in a lot of these places, there's one toilet that is serving over 500 people in a small community. And it has been proven to be a challenge to many of these women and girls because their safety is compromised and their health is also compromised. What do you think can be done to help these women and girls in these rural areas? Hello, Honorable.
Had unmuted, sorry. I've unmuted, sorry. I was saying that in addition to the one toilet, in addition to the lack of safe spaces, the biggest challenge is awareness by the community and the way the community takes it. Under the Namayanja Foundation, we have had opportunity to interact with the community leaders. And when you look at even the names that they give menstruation, and we were in a community meeting, and I don't know whether Daniel has already joined in. We were with Daniel, and he asked a question.
I am on, Honorable.
Yes, Daniel, I'm referring to the meeting in Kasangombe.
Yes,
with the community people. And when you asked how they would refer to menstruation, the names themselves are stigmatizing. And when you say Akasamvu, and then somebody says Red Sea, and then so it is really stigmatizing. To me, first and foremost, is sensitization of the communities, both male and female, such that the brother at home does not see blood and thinks that there is, and laughs at this girl. Instead, this brother must know this is a physiological issue. How do you come and that. So there must be a discussion that to break the silence about the whole thing. Because even if we give out, which we do on our part, sanitary towels, and then training them to make reusable towels, until we also approach the community level and say, this is who we are as a community, this is us, and we are in this together. Otherwise, many of us, I'll give a personal experience. I studied from Light College Katikamu in Masulita in Wachiso, and the uniform up to the present day, by the way, the uniform is white. From O level, it's a white dress, and A level, it is a white skirt and a white blouse, and we used to move with the sweaters, not because it was real. Move with the sweaters not because it was cold, but because of the eventuality that in case there is a leakage, and that whenever a girl would face that, you would see the way other students respond, and that kind of stuff. So for me, first and foremost, is we have to do it concurrently. We sensitize the masses. We ensure all stakeholders, government and civil society and everybody, we ensure we create those safe spaces. I looked at the circular by Ministry of Education. There's supposed to be a safe space at these schools, especially primary schools, and emergency towels in case a girl faces a problem or whatever. So creation of safe spaces, and yes, I agree entirely. The issue of one toilet serving both gender it's a pathetic situation. Back to you.
Yes, thank you. To Irene, based on what Honorable has talked about, and stigmatization and name calling of something as sensitive and as personal as that, is that the same thing that happens in these private institutions that you go to reach out to girls? Because we realize that there's an information gap even in certain places, and we feel like that needs to be addressed, not just in rural areas but also in more urban areas, or amongst people who are more informed about certain things.
I think most people fear the word menstruation, because for my interaction when I go to schools and I'm interacting, usually their headmasters for the first time, the moment I talk about what the organization does and what we want to do, they tend to want to call in a lady immediately. And I always make it a point to talk about menstruation hygiene with the headmaster throughout, and they always seem a bit too nervous. So I agree with the Honorable, we need to have this conversation. The moment it becomes an okay thing, the way I can talk about matoke, and there's nothing bad about it, the way there was stigmatization about HIV, and now people can easily talk about HIV openly, we also need to have that, create that awareness at all levels. And what we are doing as a Center for Tomorrow, we are involving also boys. When we go to train, we also include the boys so they can also be able to be supportive, because you find that when you ask the young girls most of their problems, you find they kind of relate to boys. When I'm in my periods, I'm afraid the boys will laugh at me. When I'm getting breasts, I'm afraid the boys will laugh at me. So you find that you cannot do this without the boys. I've also had trainings where I tell the children to invite their mothers or guardians. And when you interact with the guardians and you ask them, have you ever talked to your child about menstrual hygiene? Most of them are shy. The few that have talked to them, they say, my daughter is so bold, she's so talkative, she kind of cornered me into talking about it. So we need to get the parents also involved to talk about it. And there's also some research that I read about, I think it was in Kenya, they involved the parents in menstrual hygiene. And when they involved the parents, they also involved the fathers, not just the mothers. And in that community, it so happened that some of the fathers in that area started constructing girl toilets in their own homes so that the children are catered for. So I believe if we engage communities, both the private sector, the public, government, and all other NGOs, and we all work together, we can be able to create some of these safe places in schools where girls will feel comfortable to change. But most importantly, I think information is key. Once the children don't even know what to do, because you talk to some girls and they say the first day it happened, I cried so much, I was so afraid about what was happening. And when you have such a scenario where her first menstruation, she has been traumatized, you find that many times she will miss school. That's why research shows that girls miss over 11% of their school year due to menstruation.
Yes. In addition to that, in stigmatization, do you believe that there should be a different approach taken to teaching menstrual health in schools? Because we realize that from a certain class, we are told the nitty-gritty is it happens like this, it happens like that. And that's the most that children know about it. Do you feel like extra steps should be taken to educate these children, to enable them to sort of destigmatize certain topics in society and make it a more comfortable and inclusive place for both girls and boys going forward?
Yes, I believe that, because what usually happens with young girls is that they are shy about things. You remember, I think when we were in P5 and we were talking about reproductive health, and they were drawing a female private part and a male private part, all the kids are laughing. They're even shy to talk about it. So the more we make it comfortable about talking about these things, and that comes with the frequency of talking about them and the details with which you attach to it. So the more we do that, you find that it becomes normal. But if we are only, now you find that in most cases, if there's a menstrual hygiene training, they call off the girls, they put them in some hidden place, in some class, And I tell the boys, you boys go play. This is none of your business. So the boys are thinking this is something to do with girls, must be something funny. So already you're showing that this is nothing to do with you boys. But if we have these trainings together, it's going to create a change.
Okay, thank you. Let's move on to a bigger group of the market women. Recently, when the lockdown was happening, was starting, a directive was made that people should sleep in the markets and at their stalls. And it begs the question, are the facilities that these women have or the facilities that they use sufficient or safe for them? And it also makes us question certain things because we realize that these market women are even without pandemics happening, these market women are at their stalls every day in, day out. You never see them leave, but we know that they go through this. So it begs the question, are these women okay? Are they using the materials that are safe for them? What is on the market that is safe for these women? What can be done to help these women? Because we realize that certain sanitary products are quite expensive. For example, you find a packet of pads ranging from 2,500, 3,000, or even up to 8,000 shillings. That is not something that is an option for many of these women to afford. And realize, and these women, you might find, are not making more than 50,000 at a time. And you find that it is a burden for many of these women and girls or young women to buy sanitary products. So what are these women using? Or what can be done for these women to make things more affordable for them? I give this question to Meddy.
Thank you very much. I think from what you have said, I think it is, though we don't have concrete data on us, but it is obvious, like to everyone, that it has been a very, very bad time for these women in the market. They have been the heroes for the entire country in this response, and I think some of the possible solutions could have been, one is we needed to have more SRHR advocates in the response. As you don't know if you have noticed, but most of the response was really mostly clinical and public health. So they really prioritized spread, and some of these SRHR, especially menstruation, and they didn't really surface in the discussion, and we're just realizing them after. So maybe we should have had more of these advocates, and more of you and more of us within this discussion. Then two, the COVID already found us when we're already almost breaking. The system was already broken. Most of the markets don't have adequate wash facilities, that is water and sanitation. Maybe for the new ones which have been constructed by KCCA, the Wandegea, those ones which are a bit modern. But if you go to the other typical markets, they don't have private spaces for wash. So it begs the question of how are these women surviving? And then you come to the response, then you require them to stay there. And as you have mentioned, the prices. So some of these women have been using pieces of cloth and any other thing that could absorb the blood. So it has been challenging for them. And moving forward, we need to have more of these conversations surface to the policymakers, that when you're putting up these directives that women should stay in the market to serve the nation, on top of giving malaria nets, if you had SRHR advocates within this response policy making, giving out pads would have, and also guaranteeing that the wash facilities are inclusive of women, would have been some of the priorities. Yeah, maybe others can add on.
Irene, do you have something to add to that?
I can also. Oh, okay, no, I'm good. Yeah, I think it's very key that we plan these things ahead, because I think we need to look at our infrastructure so that when you're constructing toilets, wherever, school or not school, there are always women, there are always girls. Can they be a provision for where women can dispose of their parts? Can there be a place where women can safely go in? Can there be a place where there is water in the women's bathroom? Because like the Honorable said, even me personally, when I was in high school, I always used to move with a sweater when during those days. And there are so many times that I ended up using that sweater. And I used to rush to the toilet because this was a single girls' school. I rushed to the toilet, wash with soap. You find somewhere there on the tap, and then tie yourself again and rush to class and wait for it to dry. So you find that there is always need for water and soap in a women's toilet. So can the people who are policymakers ensure of that? It would really help, because right now, by the time the directive was given, it was too late. Like Meddy said, it was already a broken system.
Yes. Daniel?
Yes, please. I think I will share the views that Meddy shared, but just to hint on the bigger picture, especially for those ladies who have stood out as heroes, I think mine is learning from this situation. Going forward, I think we need to do thorough gender mainstreaming as we do plannings. These plannings for structures like markets, different infrastructure. We have to ensure that all those components are incorporated in the plans. Because if these are, for example, the changing room, the washrooms, the water sanitation facilities enough for the women, if these are not incorporated into the plans, it will be very, very hard for you to have these provided for, because in that case, you already have a budget which is catering for a structure minus a washroom. So making sure that even when our planners are doing the work, let them bring on board these other people who have expertise in this area of gender mainstreaming to ensure that these plans are inclusive to cater for all the needs of the people. Thank you.
Once again, thank you everybody who is tuned in, watching this webinar live on the various social media platforms, studentsagainstcovid.com, and follow the conversation on Twitter on our social media handle, that's Students Against COVID. And there's a hashtag going around that is for us to engage in this conversation. Retweet, comment, retweet, tell a person, tell another person, educate the nation, you know. So, and we also apologize for the miscommunication in time. It was a miscommunication on our end, and we are gravely sorry for that. Meddy, you raised your hand.
I just needed to re-emphasize the previous point of having males included in these conversations. Maybe I can share the boy experience. Like growing up, whenever would have these talks, the senior lady would take on the girl cohort, and then the senior, was it the senior man? The senior man would take on the male cohort. So there was always this type of separation about this conversation. So when you reach national planning, or when you reach policy making, or when you reach any other platform, men are quite ignorant of this other world that's happening, because they have not been concerned about it, or they've not been involved in it. And we need to have more of this conversation. We need to involve boys in this conversation. We need to have them engaged. There was a UNICEF project where they involved boys in making reusable pads. I think we need to have more of those, because it can build empathy from the male cohort, and then it can synergize the efforts of menstrual health management.
Thank you very much for your insight. Irene, you raised your hand, Irene.
Yes, please. To add on to that about the impact of COVID on women, we also need, because we cannot change what has already happened, like when you're talking about infrastructure, there's little that we can change, but we also need to involve women in the decision making. You find that for the COVID response task force, it should have women that are going to represent fellow women and talk about such issues. Otherwise, you'll find that what is being called as priority is not involving some of those cases of menstrual hygiene that actually are affecting women and can also lead to economic downfall. So we need to have women also part of the task force.
I received a suggestion from a person who I was sharing with before we had this webinar, and they mentioned that in those care packages that are being given to homes, they believe that sanitary materials should be part of the materials that they are giving to homes, so that it can help people who cannot afford to buy certain or things that they may need, or people who are in far to reach areas and have lost their sources of income that could help them buy sanitary materials. So how best do you believe or do you think this can be implemented by our decision makers? I see you raised your hand, Daniel.
Okay, thank you, Chair. I think the decision makers will need to do, like I said earlier on, how do we change our priorities to target the most affected groups? I will use your example. Last week in the news, we saw a story that was making rounds on social media. The story that the unfortunate incidents in Kaliro district and Luuka, where we had 60 young girls impregnated. And
Yes.
when they went ahead to investigate the story that ran on NBS, one of the girls confessed that she got pregnant, and all the perpetrator asked for sexual advances in exchange for a sanitary pad.
Oh.
So it means that we must be able to identify in this crisis who are the most affected. And as we talk about the new normal, because this is going to be, the situation is going to be with us for a longer time than we anticipated. So as we are planning, because planning is going on, the president last week gave us the State of Nation address, and next week we shall be having the budget read out. So it means even at local governments, the planning is going on and implementation will be taking place. So how best can we reprioritize and make sure that these few resources that we have and the few resources that are coming in from our partners, for example, Rose Namayanja Foundation, that's a team that is doing a lot of work in Luero. So how best do we use these few resources to make sure that we target that group that is most affected? So if the girls out there who have initially been in schools, because as Ministry of Education, the policy has been, we are not able to avail every girl with a sanitary pad, but we've empowered schools to have at least emergency sanitary pads at every school. That has been the practice. But because of the fact that these girls spend 9 months in school, which is not the case now, they're going to spend more time at home. So now who is the target group? Meddy was talking about the senior woman teacher, the senior man teacher. Now the senior woman teacher is the mother, is the auntie, is a grandmother, is a sister. That sibling that this young girl and this young lady is staying with. So how do we target that new group who are taking up other responsibilities? If it is the auntie staying with these young girls, how best have we empowered this auntie with information? If they are very impoverished, with material to support this young girl to go through menstruation without necessarily being standing a risk of going out to these negative bystanders in community who are going to take up this advantage of, you're needy and you need this pad. So if I give you this pad, you're giving me sex in return. So how do you guard against this? So I think going forward, for me, it is still targeting now the new caregivers who are the parents, the aunties, the uncles, the fathers in these homes with the necessary information and the material to support these young girls. So using all the structures, the district structures, the sub-county structures, the village structures, to make sure that we reach out to this girl in their home. Thank you.
Thank you, Daniel. So do you think that the media can be used as a tool to demystify and change myths and beliefs around this sensitive topic?
Thank you very much, Chair. And I think you go straight to the point. When you're talking in the situation we're working in, you've heard of the standard operating procedures. That
Yes.
for a long time, we're going to be practicing social distancing, putting on masks, among other guidelines, as the Ministry of Health has guided. So it means that the best way to reach out to a big percentage of people without necessarily increasing their risk of contracting the virus is using media spaces, like what we are having now. In a different circumstance, without this new normal, we would be meeting maybe in an office to discuss these issues. But because of the virus, we are meeting online. So this is space we are using. So likewise, I advocate that let us utilize our radio stations, especially the community radio stations that reach out to the immediate beneficiaries. So like you said, going forward, we're going to need a lot of media campaigns in order to tackle this problem.
Honorable, I can see you have your hand raised. Do you have a question or something to emphasize? Just a second. Let's unmute. Honorable, just a second.
Hello?
Yes, please. Yes, yes.
Just something to emphasize. I agree entirely with the issues raised, and I'm glad we are having this discussion. And what Daniel is saying, going by the new normal, you realize it's even, and the media, really, it's now even much cheaper than, I mean, bringing all of us and the logistical issues of all of us who are involved now, getting into a meeting to discuss this and everything. You realize we are doing much with the media. And whenever we talk about advocacy, inevitably we have the media linked in. And we have to look at media in all its forms, both conventional and social media or new media and the rest. But Irene brought out 3 issues that really were very, very pertinent for me. The P5 reproductive, the reproductive topics we were studying in P5. We learned about the secondary sexual characteristics. I think it is at that time, all I remember, they would say a boy will have some beard, the voice will be deep, and then the girls, the breasts, and what have you. During our time, they never even brought out the issue of menstruation. So right from P5, even if this child has not yet heard about it anywhere, but at that level, when we are talking about secondary sexual characteristics, it's important for us to begin the discussion there, and in a class where boys and girls, just like they can draw female genitals and male genitals, and these kids are laughing, but still at that time there's information that is picked, because we're looking at this thing from different layers. One is us, the old people, the mature people, the ones who are doing the advocacy, and then the young people who are going to help us do the real changing, whose minds and hearts we must change at this time. Still, Irene talked about the issue of, can we talk about menstruation just like we talk about matoke, just like we talk about HIV/AIDS. HIV/AIDS was stigmatized, and even by calling it sirimu, you know, it was really something that in a village or location, they would see somebody suffering from HIV/AIDS, and it was a huge, big thing. But today people come out and say, I am HIV positive, I'm living positively. So, and yet this is a disease, and we all know everything about it. But for menstruation, I think that's the advocacy is highly needed for us to ensure that we talk about it just like we talk about anything, not like ensonga, mwezi, the language that is used. I keep referring to, using the Ganda words because that's the environment I've grown up into, but there must be similar words in different languages to mean that. And then you talked about the policy makers and the women on the COVID task force and that kind of stuff. I think for me, it's not just women being there, but we who are there are the women who have gone through that stigma. And it also calls for awareness of the policy makers. When Meddy and Daniel talk about this, they understand it and they are even free to talk about it. But are we sure that women who are not directly involved in this advocacy and are in positions of leadership at the various levels, be it political, corporate, or church, religious, or anywhere, are they free to talk about it? So we also need to do that sensitization. I don't want to say that maybe it was not done in the pack or the package they're giving to the communities of posho and beans and whatever, that it was left because women were not there. But maybe it was not an issue. You brought out the issue of women in markets. If we had come out, even if government had not done it, other organizations and the corporate world, we saw people giving in and supporting the COVID initiatives, but we didn't, because many of us have grown up in that background of you don't have to talk about this. I have a friend of mine, he's a corporate guy, and we're just discussing about this issue of menstrual hygiene management, and he says that for him, when his daughter makes a list of requirements to go to school, he handles everything and he says, this one, you go and talk to your grandmother. And this is the father of this girl. So awareness of the mature people, the old people who have grown up in the levels of stigmatization of menstruation is as important as involving the boys, the brothers at home, and then ensuring that we create the safe places. Thank you.
Thank you, Honorable. Thank you, Honorable. I hope we're still clear and together. So that brings us to the next important group that we should look into: people with disabilities. How does this information reach them, especially the girls and women in schools in rural areas, those who do not have access to certain facilities? And also, when we look at men who are people with disabilities, are they informed about menstrual hygiene management? And in these communities where people with disabilities are they informed about these things that need to be done and products and things they might use so that they are not left out in this conversation? So I forward this question to Daniel.
Thank you very much, moderator. We've been talking about those unique populations. We talked about the people in slums. I think when you talk about people with special needs, I think it is also a unique population that I think needs urgent attention, without which they also lose out on a very, very big opportunity of getting helped. So when you talk about people with special needs, Honorable was talking about stigmatization. I think these are people also who have suffered the same fate. Even family members. Have we gotten to a level where a family in Uganda, even when they have a learner, a young girl, a young boy with special needs, they look at that boy with this lens that this boy will grow up to achieve, that this girl, regardless of their vulnerability, they will grow up to achieve to their full capacity. That is not the case. So meaning first we need to, as we program, we must integrate in a component of making sure that we break the cycle of silence, of stigma around the people with special needs. Many of our people in the communities look at them as second class citizens. You know, after the able ones, then we have the disabled people. So we must get past that level and look at the young people, the young women, the young men with special needs as first-class citizens. So if you're looking at them in that manner, then you're going to be able to plan for them. Then the other issue also goes to representation. In terms of representation, I think from the national level and from the policy level, there are a number of legislations and policies that speak about people with special needs and making them a bigger component to planning. But is it the practice? So if it is not the practice, what is the problem? So I think for me, it is still a bigger issue of stigma that is affecting this unique group of people. So the issue is not the resources, but still the stigma that if we have a small team like this one, and we want to elect a chairperson, and we have a girl or a young boy with special needs, or they are lame, do I look at this person with able abilities to take leadership of this group? Maybe I don't do that. Maybe I do that. So that small gap in terms of appreciating that these people are able and they can achieve to their full ability. And the only difference that is there is denying them an opportunity or providing them an opportunity. So what we advocate is let there be equal opportunities given. And in terms of equal opportunities, I'm talking about looking at it in an equitable manner. That if you have an intervention and you know that the way this intervention is being rolled out, these people may not be able to access these resources, then what do I do? In the constitution, they call it the affirmative action, which has been supporting the young people with special needs, the young girls, the young women, to get these opportunities provided for by the constitution. So having that affirmative action incorporated in all the small programs that we are running out, I think is what will enable us go forward. Because without the affirmative action, we shall fall to the same barrier of stigma. So because stigma is not going to go away in 1 day, 2 days, it is a gradual process of breaking the cycle of this stigma and the silence. So as we break the silence around this whole component, let us back our efforts on the affirmative action policies to make sure that these young people with special needs are taken care of, especially when you talk about issues of menstrual health management for the girls and issues of the negative impacts of COVID to the general community, especially the vulnerable communities. Thank you, Chair.
Thank you, Daniel. Irene, I see you have your hand raised.
Yeah, I want to talk about change of mindset. I find that many times when you're talking about periods, people kind of say women can always handle. I think society has this thing that women can always handle anything hard that is thrown at them, and we do not need to know the details about it. It's the same thing with people with disabilities. You don't want to know their struggle, but you want them to come out through it strong or something. So we need to change. We need to be more sympathetic about the needs of others. the policymakers need to be sympathetic. You do not have to know, you don't have to have gone through such a hard time or suffered that exact pain for you to understand someone else's pain. So if we look at it in that way, because the way the donations were coming in for COVID, no, you found that people are concentrating, yes, on food, and that's a good thing. I'm not complaining about it. But no one could start thinking about what about the woman that does not have a pad? How is she able to survive even if she's at home? And when you ask someone such a question, usually they say things like, oh, but you women, you have always dealt with it. Our grandmother dealt with it. Our mother did it. We don't have to know about it. We need to find a way of brushing off that mentality. We need to change mentality that you do not have to live with a hardship. Like we don't want to live with some of those hardships. We need to solve them. We are tired of that moment of always brushing off the things that kind of get to us or things that actually affect our social and economic well-being.
Thank you so much, Irene. Meddy, what's your say on the matter?
I really concur with what everyone has said. We need to be more empathetic, and we should not just let things go on because in the past they were not discussed. So we have this assumption that it can be tolerated, and yeah, really, I have nothing to add on that. I think we need to have more of this conversation and be more inclusive and empathetic of the other groups, especially people with disabilities. Yeah.
Thank you very much. Honorable Rose?
Yes, Chair. On the issue of PWD, I agree entirely that one, we are the PWDs. I'm adding on we because these days I'm using crutches for the last 4.5 years, but they go through a lot, especially the young children, the young girls, and at times some incapacitated physically to handle themselves and that kind of stuff. So it's like double jeopardy for them, if I may use that term. Already the issue of PWD is big enough, and then you add on this aspect of stigma and managing, and even failure to get the sanitary towels themselves. And this is compounded by the fact that some of them cannot be able to earn a living by themselves. And the situation has been exacerbated, of course, with the COVID dynamics. Just imagine these women who at times are on the streets begging to get something. How do they go through this? What about a PWD girl who can't even speak and is seeing blood for the first time? So it's a different dynamic, but by and large, I think we just need to increase advocacy to ensure that the issue of menstruation is mainstreamed in all aspects of our endeavors. Once we have it mainstreamed, just like we mainstreamed many of these things, still I will refer to the issue of HIV and AIDS. When HIV and AIDS was mainstreamed, even corporate organizations have their policies on HIV and AIDS. The government institutions have their policies on that. The districts do have their policies. The schools have incorporated it in their programs. So what we must work towards too, from a strategic point of view, is to advocate and ensure that the issue of menstruation or menstrual hygiene management is mainstreamed in everything that we do.
Thank you very much, Honorable. Meddy, you had your hand raised.
Yeah, Chairperson, just a little bit.
Please.
I had changed my meeting because I had a meeting at 10, which I changed it to 11. I don't know how long the discussion is going, but I wanted to start the other meeting.
Yes, please.
But in my closing, I just want to thank the panelists first and foremost for this information that has been shared. You, the chairperson, Meddy, Irene, and Daniel, and the Students Against COVID initiative and the Rose Namayanja Foundation, the team that has put this together, everybody. I want to thank you, and this should just be the starting point. Let's continue having the debate and engaging in the different areas and supporting each other and supporting the women of this country. I thank you so much.
Thank you so much, Honorable Rose. It's been a pleasure having you, and we hope to have you join us again very soon.
Thank you so much.
So back to Meddy. Meddy, you said you had something to share.
Yes, I just wanted to, I don't know if you can see my screen. I wanted to show you, this is one of the interim reports on gender-specific risks associated with impacts of COVID. And if you can see,
Yes.
they try to, it's really broader, but if we are to address some of these, we need to fit within a bigger framework, because we may not have another conversation for gender-based violence, or we may have another conversation for abortion, for fistula. So this tries to give a broad picture, and clearly there are so many aspects of the life of women's lives which are at risk, and I hope in the next conversation we will address some of this. Some of the possible solution, I think, is we need to get better data. The data we have, really, we are collecting for COVID is aggregated, and we may not be able to pinpoint the impact is having on women. So we need to disaggregate the data, and we have more data specific for sexual and reproductive health. And then we need to move in with some incentives to more blunt the trauma this COVID, especially the restrictions due to COVID, will have on sexual and reproductive health. And for menstruation, for menstrual health management, some of the incentives, some of the affirmative action can be reducing. Of course, the economics will have another discussion, but we could further reduce the taxation, or maybe we could provide incentives to reduce the prices of the pads. I know the Ministry of Health, Minister of Education already had conversation in the Parliament about providing free pads, but now in this response where everyone is really living on pennies, we need to provide these incentives to further reduce the prices on pads and other SRH services and products. Thank you.
Thank you so much, Meddy, for your insight. So I believe we should move on to the next part of this discussion, where we ask, are the men supportive in this conversation? Have they been included enough in the menstrual health management conversation? And how best girls stigmatized? They are hindered from going out to help others and help the family earn some money. And how best can the men be helped to understand the size of this situation? I give that question to Irene.
Personally, let me give a brief story of what happened recently. I think sometime last year, I was doing menstrual hygiene training, and I was teaching girls about menstrual cycle. I was teaching about menstrual cycle because they kept on asking, how do I get into my periods? How do I know they're about to come? And I felt if you train them about menstrual cycle, they will plan better. Maybe 2 days before they know they are going, if they have regular periods, they'll be able to carry the pads with them. and that. So I put that on Facebook, and then a gentleman attacked me saying, this is a private matter, you should stop talking about this, these are for to talk about. But before I was a bit pissed, but thankfully before I could respond in any way, I had about 10 gentlemen explaining why it matters for men to be involved. And all those gentlemen that were talking about it, we're talking about scenarios where they've had a woman maybe spoil her dress, and then they offered help. All those gentlemen were giving about all those scenarios. And I felt really moved. And I think it's something you can compare to men who are submissive to their women, men who listen to their women. There's this tendency of culture saying, like, you're too soft on your woman. You need to have a hard handle about issues. So if you find a man who is actually very respectful of the woman and is being bullied by other men, but is not responsive about it, that kind of man is like a model that could kind of could carry that kind of behavior to teach other men. So we need to find men that are okay with talking about periods. When they are okay with discussing periods, they can be able to show other men that it's actually okay, it's an okay thing to talk about, and it's a natural thing. So we need to involve men more, so that the more they get the information, the more they are casual and easy about it, and the more they'll be able to spread to other men that it's an okay thing and we shall embrace it all.
Thank you so much, Irene. Daniel, how best do you think men can be involved in this conversation to demystify the whole menstrual health management issue? Daniel? Okay, let's pass the question on to Meddy. I think Daniel is lost for a second there.
Okay, so for me, I really think it begins with all the girls out there and all the boys who are already or have this information. It really starts with a simple conversation, whether in your WhatsApp group or when you're with a boy, and when you're in your period, and you're having a conversation about menstruation, and you come out like plain clearly, and you have this conversation. Sometimes when girls are in this, you just keep quiet, and the boy is supposed to use some supernatural sensors to tell, and then you avoid the conversation. You be very, very, very cautious not to piss her off, and then you pray that it's done, and you wait next month. We need to have more of this conversation. Maybe we may need to have more radicals, still and Nyanzi, with some moderation, but we need to have more people out there who are the best campaign for this. And of course, it goes back to the schools. The first experience encounters we have with menstruation. When I was in primary, I remember the time when I first saw a girl who she had soiled her dress, and she was clearly in shame, and she was hiding, and it was we never talked about it. It was that, I don't know, it's a taboo in many societies to talk about this, because you take it as it's for women. So maybe we should have more sexual education, inclusive. We don't separate the boys and the girls and talk about koja and senga the way it has been for years, where sengas talk with girls. We have a more inclusive conversation, and maybe moving forward we'll see changes. Of course, we'll have ons and offs, but if we talk about it more often, we get more people to own this campaign, maybe the future will have less suffering due to menstruation.
Thank you, Meddy. Daniel? Okay, let me pass on to Irene. Irene, yes, please.
Hello, Chair.
Okay, just a second. Yes, Daniel.
Sorry, I think, get me the question again. My network was buffering. I didn't get the question right.
Oh, okay, apologies. How best do you think men can be involved in this conversation revolving around menstrual health management, and how best can it be done for them to demystify this issue? and not demonize it per se.
Okay, thank you very much. Many of the colleagues have already shared, hinted on using the men as role models, but I usually tell my colleagues, and when I'm facilitating on such topics, that all of us here are a product of the missed period. So, meaning that if your mom was not menstruating, you wouldn't be here now. So, meaning we must embrace the fact that menstruation is normal. That is the first, the starting point. That just like a young boy grows up and they develop beards, likewise, this girl grows up and they start undergoing their period. So for starters, it is something that is very normal. So then demystifying the myth and misconceptions. After that is when we bring the males on board. And this has been a practice in schools. Way back when you would go to do outreaches, you would go to schools, those rural schools, you would see the senior woman teacher seated under a mango tree with a group of girls. And when you try to inquire, what are these people doing? They will tell you, they're talking about some issues. Like, which issues are these? Like, they're talking about issues for the girls and all that. Even the head teacher is not confident to tell you that, the senior woman teacher is supporting these girls to go through menstruation in a more healthy manner. So meaning that now the practice is when we are training the girls to undergo through menstruation in a way that does not undermine their dignity, in a way that is healthy, we bring the boys on board. In fact, in the schools where we've gone to support the girls in making the reusable sanitary pads, it is interesting that the boys even are making better pads than the girls, but they don't use these pads. So they give them over to their counterparts. So that's kind of opens up the minds of this young boy that this is something that is normal. In any case, this boy is going to become a father. This boy is a brother. This boy is an uncle. And when they go back home, they will use the same values to support a girl out there. So for me, it is in all the work we're doing, let us have the men on board. Let us identify, because not all of them are doing badly. So can we identify the good people, the role models, and use these role models to speak to the men? Because if a fellow man sees me supporting a young girl to train them on how to put a pad onto the knicker, then they will know that, this is business for everyone. So ensuring that males understand that menstrual hygiene management is everyone's business, and identifying role models amongst the men themselves to support the cause. There are a number of men out there who can't even buy pads for their wives. The guy enters a supermarket and they can't buy a pad. Not that they don't have money, because of the stigma. Like, I buy a pad, it looks like you've narrowed me down to I don't know what, but it is very, very deep-rooted stigma. So they would rather give the girl or the wife money that, you'll buy these for the girls as they go back to school. Why can't the father buy them? So using the role models amongst the men to champion our cause. Thank you.
Thank you so much, Daniel. Irene?
Yeah, usually what happens, what Daniel was talking about buying in the supermarket, it also goes to people thinking maybe he's not money enough. You understand? So the guy is afraid because he thinks people will think he's not money enough. But then that was just supplementing what Daniel was saying. But for me, I also think the other way to get men involved is showing them the bigger importance of menstrual hygiene management, why we need to do this. Because if you're paying school fees for your child to stay in school, for your girl to be in school, and you want them to perform very well, you're sacrificing probably 200,000. Then you need to also be able to save and afford the 4,000, because that 4,000 that is on top of the school fees, the 200,000, is what is going to help your girl be empowered, have dignity, and also perform better in school. So we need to sell the value of making sure that the girl is comfortable in school. Then we also need to look at it as, if you want your child to be clean, not to have diseases due to using unsafe measures, you have to ensure that your girl uses these pads, gets sanitary pads that are hygienic. So we need to sell that kind of big picture. And also we need to, when you look at issues of environment, how are the girls disposing them of? So you have to involve the men to also know that while you're not concerned about what is happening, about what the pads are, what kind of pads they are using, there could actually be a hindrance to the environment. In my school, the headmistress used to be harsh because people are not disposing of their pads very well. So they could throw them in the latrine, and before even the end of term, the latrine is full, and then you have to pick them up and then burn them. So all that inconvenience. So men need to know that when you're helping your child or your girl to be able to dispose of the pads very well, because remember, some of these are very young girls, like 12 years, and they know nothing about conserving the environment. So we need to look at all those attributes, and that goes down to the SDGs, Sustainable Development Goals, quality education, gender equality. If you want your girl to also have the same equal opportunities as the boy, then make sure that healthy enough, make sure that they have the pads to stay in school and concentrate. So you look at actually about 5 SDGs talk about this: quality education, gender equality, clean water and sanitation, making sure that the girls can be able to wash themselves when they are their time of period, reusable consumption and production, and then decent work and economic growth. All these SDGs actually cover menstrual hygiene and management. And if we sell this as a point of the importance of MHM to men, you could find that they would kind of pick interest.
Thank you so much, Irene. Thank you so much. So let's move on to another part of this conversation where we should discuss products and the things that affect women when they are menstruating. For example, a question came in where someone has asked me to ask you, Meddy, to talk about cramps and how they affect women. It's known that a lot of women experience these and they are downplayed by people around them. People imagine that it's not that big a deal. Why are you crying over it? Why are you claiming you can't go to school or go to class because you are cramping? So tell us more about cramps from your medical perspective, Meddy.
Thank you for the question, though I still felt it was better addressed by Irene. Yes, but of course, what I know about cramps is mostly from the theoretical point or from the experiences I've had with my friends when they go through them. Of course, they are not imagined; they are real pains, and of course, boys have had these. When you're with boys, you hear all the wildest theories about them. But from the male perspective, there's a clear undermining of the cramps, and many boys think is something that is faked. But I from a medical perspective, these are something that are real and they're very painful. And for some people, they're actually debilitating, and you have to give them medication. So I think Irene can take over from there.
Thank you, Meddy. Irene?
From the girl, what we usually do with our MHM trainings is we ask the girls to write secretly questions that they have, concerns that they have about menstruation hygiene. And many of them talk about the pain, the back pain. I have stomach pain. Is there something wrong with me? Things like that. And the problem is, personally, as from my experiences, sometimes you tell someone you have cramps, you can't be able to do something, and it goes back to the mentality of women always have menstruation cramps. Deal with it. You understand? So they kind of brush it off. They don't want to understand, because you can't tell me, because many Ugandans suffer from malaria, that when I have a malaria case, you should just tell me, oh, everyone suffers from malaria in Uganda, so go deal with it. We need to look at it like that. At that point, it's like a disease. You're in so much pain. I know I used to have a roommate at campus who used to go on drip every time she was in her periods and was not able to attend classes. I've had other friends who just lay in bed like for 2 days and they take very strong medication. So it is a very serious issue that men need to be just sympathetic. It does not mean that if you have not suffered that pain, that it does not exist. So they need to be more accommodative. What you don't know doesn't mean it's not there. So I just request men to be more accommodative about that. But then we also need the Ministry of Education to address that issue of when a girl, for example, if I go into my periods and I'm at school and I get cramps, does it mean that a girl should miss school because she's having cramps? Does it mean that it should go back home? And many times when you go back home from the parents that have when you interact with the girls, the parents do not help much. They just say, you go to bed and sleep. So I'm going to go to bed and sleep. I'm missing days of school. Aren't there, isn't there medication? Isn't there, can't we have nurses in schools that can help with the painkillers, with the prescription that a girl child needs? Because it doesn't mean that if I'm not feeling well, that I should actually lose those 24 hours or 48 hours of my life. We need to address that. What are the schools doing to help the girls when they have cramps at school?
Thank you so much. Thank you so much, Irene. So let's direct this conversation to the last part of menstrual health management, affordable products. A lot of people are concerned about the methods or the products that people use. For example, on the market, there are various types of pads, but you find that they're not affordable for one reason or another. And the most common reason is that most of these products are imported and taxes are imposed upon them, and that makes the best quality products very hard to afford for a lot of women. You find that the best pads on the market are about 5,000 shillings a pack, and not many people can afford to buy pads at that price. And the pads that are on a lower end budget are not of the best quality and affect women very badly for some. So, and not many people are open to using reusable materials for one reason or another, that it's inconvenient for many of them, or for others that they are just not okay with this. We've discovered that there are some companies that are trying to make locally made pads. For example, a local celebrity, Shiba, made a company called Holic Pads, where in her company they manufacture pads, and they are soon to be on market for the Ugandan market. But how best do you think? What do you believe are the best products for people to use, especially in this time, Irene?
Personally, I believe reusable because it's the most affordable. And like you said, many of them that low end usually ban, because
Yes.
My first training with training girls about reusable pads, the parents came and they pleaded with me, please don't give our kids this brand. I don't want to mention the brand because it bans. And they're saying, they told me themselves, may I use clothes? Because I fear pads, they can burn you and they can make you sick. So I had to talk about the reusable, how it's cloth, how it's cotton, and it's safe. So you find that those that are really good, that have a cotton feel, usually are too expensive. Those that don't have a cotton feel, that burn, are affordable. So I would personally, I vote reusable sanitary pads because they're easy to wash. They don't cause any discomfort, and it kind of saves money. Plus, I so like them for the fact that they cannot be shared. Because the moment someone could buy me a pack of pads that are disposable, when I reach home, I stay with my sisters and everyone picks one. So before even I finish my periods, they are all finished. But when you have reusable pads, you find that what I'm going to use, I'm going to wash clean for the next month. And I'm sure none of my sisters will get into my drawer to borrow one, because it feels like a pantry, so you cannot share. So personally, I vote reusable sanitary pads.
Thank you, Irene. To Daniel, how best do you think policymakers should be involved in this conversation, especially around taxation upon such products that has made them almost unaffordable for a big majority of the population?
Thank you, Chair. And thank you, my colleagues, for the views coming in. I think looking at issues of policy and especially taxation, I think still the wisdom would suggest that we have tax waived on a number of these sanitary materials. But the number of factories are dealing in these materials. So which taxes would we advocate for? Because for at least as a unit in the Ministry of Education, we've been monitoring this because it is what we've been advocating for. So there are obvious little taxes being waived off these materials, especially those coming from outside Uganda. But we want it to be tax-free. And if it is totally tax-free, it means more products will be on the market. And when more products are on the market, then the prices automatically will drop, with the intention of making sure that they can be accessed by everyone. Then the other area would want to look at, still in the area of taxation and industry and production, is giving maybe subsidies to our local markets. My colleagues here were talking about some of personalities in Uganda that are running these factories that produce produce pads. Can't we go ahead to give them subsidies, issues like tax holidays, to ensure that we promote production, and also making sure that the end product is very cheap for the young girls? So yes, I don't speak for the Ministry of Trade, Industry, and but from my view, from my sector that I work for.
Hello, Daniel.
Hello, can you hear me?
Yes.
Hello.
We hear you.
Yeah. So I'm saying that for me, from the education sector, we are also happy if ministry is responsible.
Daniel is having a big network issue. But for now, let's hear from Irene. I saw you had your hand raised.
Tabitha, we can hear Daniel. He's okay. We can hear him.
Hello.
Let's unmute you.
Am I still online?
Irene, could you unmute?
As Daniel was still talking, is he still talking?
I think, Irene, you can yes. Go ahead. Maybe I'll pick on that when I make another submission. You can go ahead, Irene.
No. Sorry. Can you hear me?
Yes,
yes,
we can
go ahead.
Oh, okay. So just to supplement on what Daniel just said, the only way we can lower the prices is if the government steps in. Government needs to step in by looking at it in different angles. The way I talked about the SDGs. If it realizes how just providing pads can cut across so many of the SDGs or the Millennium Development Goals 2040, it will actually help to push this, to remove the taxes so that pads can be able to be affordable. Just telling the idea to them, the importance of how much it will affect the Millennium Development Goals or the NRM Manifesto, because it's also about promoting equal education for all. So, and all this can be achieved by just that one step of ensuring that girls can afford the pads, or the pads are given out freely. Back to you, Brenda. Back to you, Brenda.
I think she's having an issue. Daniel, I think you could go forward with what you were talking about right after Irene mentioned this.
Okay, thank you. I think Irene has hinted on the other part I wanted to share, but I think it's what we call the human capital. What she was emphasizing is that how much does government lose if they don't take this as a key priority? And how much does providing sanitary pads directly feed into building this human resource, building this Ugandan who can fully be productive economically, socially, and politically? So if we package our information in a way that
there is a big challenge of harassment and defilement of a lot of these girls. Just like we saw the news from the eastern part of Uganda where and policymakers do to help these girls, especially in this time, because these girls are being defiled for the smallest of reasons. Apart, someone is trying a counterpart, or some of these girls have been given away by their parents in post-marriage. And this is creating a bigger problem of so I'm forwarding this question to Daniel first.
Thank you, Chair, and sorry for the internet. It looks like it's buffering from your side, but nevertheless, I want to still hint on the last point I was talking about is the human capital. That's how best do we flag menstrual health in the eyes, in the faces of all policymakers. And we can only flag menstrual health by looking at it in terms of the human capital. That how much does Uganda lose if you neglect this bigger component? How much do we lose in terms of economic resources that we are investing in schools, that we are investing in healthy facilities? So if we quantify that, then it is going to look very clear for the policymakers, especially our colleagues from Ministry of Health, sorry, from Ministry of Finance, because I think for them, what they understand most is the figures. So how best do we quantify and present this human capital project versus menstrual hygiene management as something that we cannot do without? And it meets a number of targets. The Sustainable Development Goals that Irene is talking about, the National Development Plan, now 3, that we are embarking on to implementing. So tapping into all these strategic plans will help us to flag this and make it a policy issue. Thank you.
Thank you so much, Daniel. Irene, I'd like to hear from you on this matter.
The question again? Sorry. Because you had, yeah, please.
Oh, yes. Now that a lot of girls are out of school, we are finding a bigger problem within the pandemic, the harassment and defilement of these girls and forced marriage. Just last week, we got reports of over 60 girls in a district in the east where girls had been defiled and impregnated, and they are going to miss out on school. That's depriving them of their future and development. And this, again, in itself, sets the community back, because early child pregnancies and teenage pregnancies creates a bigger problem going forward in the community. So how best do you think policymakers can protect these children, and what humanitarian efforts can be taken to support these girls and help them?
Okay, thank you, Brenda. First of all, research shows that 1 in 3 women will experience either physical or sexual violence. And in the past time, since COVID lockdown, it has been shown that violence has actually increased by over 3 times, which is really alarming. What I think the policymakers can do, even in the terms of social distancing, is creating centers near homes, because you find that many times the means of transportation are not there. That to create areas, maybe you empower the else ones, or you empower people and in the else one's office to be able to address such issues. Just last month, a lady who stays near our home, we share a wall, was beaten so badly by her husband just because he was jealous. And we had to kind of go in, help the lady. Then the man took off. We reported the case to the local police station. The woman took off, and then we had to basically feed her in that time because she didn't have any money. But you find that many times, even after that has happened, a woman has been violated, they do not have anyone to talk to immediately. Remember, this is the time whereby you cannot call your family. For her family was in Soroti, and the husband picked her from Soroti. Okay, not husband really. The man she was staying with, her partner, picked her from Soroti, brought her to Kampala. And since she didn't have any family in Kampala, he felt he had the right to kind of use her in any way, because he was basically not even feeding her. So, but by the fact that we, the neighbors, kind of came in to find out what is happening and helped her, she felt empowered to actually go and talk to the police, knowing that, yes, if I have these neighbors that are looking out for me, they can actually help me send me back to my village. And that's what we did. As neighbors, we all contributed, came in and helped her. So you find that in the scarcity of no family members, no community members, government needs to put in more time in bringing the centers closer to the people, in creating hotlines where someone can easily call, and in also responding. I know from history, many women report their husbands over sexual or domestic violence. And once it has happened, the woman changes her mind, but does not give the police a right that when I go and report the case, you do not attend to it. It does not give the police the right to ignore, maybe on assumption of all the other women that have changed their minds. So police also needs to do their job and follow up on all those cases. If it does not follow up on all those cases, it means men are going to take it for granted that I can abuse a woman, and then police will come, they will question, then my wife will change her mind, and then everything goes back to normal. So we need to have laws, and those laws need to be implemented to the latter.
Thank you so much, Irene. I'd like to thank everybody who is still with us at this stage in the conversation. We're still streaming live on various social media platforms, Facebook and Twitter and Periscope. We'd also like to thank the Namayanja Foundation for supporting us in this webinar and enabling us to have this conversation. It's a pity that time is not on our side, but we would have loved to go on and discuss more and more in this conversation. So we were in this webinar. We had Meddy, Rutayisire, Irene, Mbabazi, Amanyire, and Honorable Rose Namayanja. And Honorable Rose Namayanja is the founder of the Rose Namayanja Foundation, that is one of our partners in this discussion today. And they've been very, very pivotal in this discussion and have enabled us to get this far. We, as Students Against COVID, we help people and students who are going through difficult times, especially in this pandemic period. And we also collect donations so that we can continue helping other people around us to get support. And right now I'd like to get parting shots from my remaining people on this conversation. Irene, what are your parting shots?
Personally, I think out of the kindness of our hearts, we can do much. This issue of menstrual hygiene, if you're privileged or if you can afford pads, you need to think about the one who doesn't have them and the pain that they go through. Already, even if you can afford menstrual hygiene products, it still gives you that you're a bit upset, you're basically not feeling good. So imagine, person is emotionally low, but also missing the physical, the sanitary pads. So it's something we need to think about for women, ourselves, and men. Everyone needs to be involved, need to be sympathetic, need to have change of mind that this is a normal thing, and let's not stigmatize young girls. I also usually tell girls in school that if you've not yet gone in your periods, don't laugh at has gone into their periods and maybe they have soiled their uniform. So we all need to, from the bottom of our hearts, be kind to one another. Where you can donate, where you can offer help, please do that. It is always appreciated. For Center for Tomorrow, we fundraise for pads, and we say we buy them at 6,000 a pack for reusable sanitary pads. So for 6,000 times 3 per term, that is 18,000. That's 18,000. You can be able to keep a girl in school for a term. So we say, be good, be kind, and share the little that you have. And Irene Mbabazi, I'm a founder of Center for Tomorrow.
Thank you so much, Irene. Daniel, what are your parting shots today?
Thank you, Chair. My parting shots, I think, as we continue to keep safe and keep social distance, I think is to have at the back of our minds these vulnerable communities, the young girls, the young women that we've talked about in slums, the girls, the 60 girls they talked about in Luka, in Kaliro, all these communities that we think are more impoverished given the facts and the evidence that is coming through. So as we get the little resources that we have, I think let us use the little resources to target the most vulnerable communities so that at the end of this journey that we are walking, the crisis, we can be able to reintegrate them into the different sectors. For example, shall those 60 girls be able to return to school? I don't know. Will many of the young girls, the young boys in those slums be able to return to school? I don't know. So unless we use the limited resources to target the most vulnerable community, we may lose the bigger picture. So I think it is, mine is focusing on the most vulnerable. Thank you.
Thank you so much, Daniel. Thank you so much for your time, ladies and gentlemen. We are Students Against COVID, and we have a website where you can check us out, www.studentsagainstcovid.com. And we have a Twitter account at Students Against COVID-19. Our panelists for today, we had Honorable Rose Namayanja, the founder and ED Rose Namayanja Foundation. We had Amanyire Daniel, Program Assistant, Office Gender Unit, Ministry of Education and Sports. We had Irene Mbabazi, the founder of Center for Tomorrow, and Meddy Rutayisire, a final year student of medicine at Macquarie University, and myself as the moderator, Namwone, Brenda, Tabitha. We are very happy to have you people with us today, and we are still receiving donations to enable us do our work and put a smile on someone's face. Probably another time we'll have more conversations and show you more of the things we have done for various people in our communities. As of now, we are signing out and we thank you so much for your time. Do put a smile on another person's face. Be safe, be happy, and enjoy.